Introducing RESTORE2, a deterioration and escalation tool for care homes.
RESTORE2 enables care and nursing homes to use the National Early Warning Scores. RESTORE2 has four key components: the soft signs of deterioration, leading into the observations that make up the National Early Warning Score, an escalation chart, and a structured communication tool. RESTORE2 can support you to recognise deterioration in your residents and raise carer confidence to recognise concerns. When people use RESTORE2, 100% of carers said that it helped them to achieve earlier escalation of their concerns. They also felt that they received better intervention from GPs, out of hours, and the ambulance service. 25% of carers who escalated residents using the tool wouldn't have done so without it. This is important because some of those residents may be at significant risk of deterioration and need treatment. RESTORE2 is also shown to reduce 999 calls and conveyances to hospital. Overall, all homes that use RESTORE2 see a reduction in their 999 calls and conveyances compared with homes that don't use a deterioration tool. This is most pronounced for care homes that previously may not have had access to physical observations. 31% reduction in 999 calls was observed in homes using RESTORE2, compared with a 14% reduction for those who use no deterioration tool. So RESTORE2 supports homes to keep their residents in their own place. RESTORE2 also supports improved resident safety. In this case, one home had a 60-year-old gentleman with type 2 diabetes. Their normal news was 1. The resident was sitting in the lounge and suddenly felt nauseous, tired, and asked to be put to bed. The nurse was called by the carers because this was unusual for him, and a set of vital signs was recorded. This showed a significantly high heart rate and a blood pressure that was starting to drop. The resident's oxygen saturations had also started to decrease. When they measured the news was now 7 to 8, and the patient was blue lighted to hospital using a 999 transfer. The patient was eventually diagnosed with atrial fibrillation, treated, and discharged back to the home. Previously, carers may have been tempted to grant the wish of the resident and put them to bed, and the outcome may not have been as positive. So RESTORE2 is key to improving resident safety. Carers say a number of things about the RESTORE2 tool. We could see that she was deteriorating and she received the help she needed quickly. We had the evidence that she was not well. It's easy when you have the evidence. You just seem to get a quicker response because you give better information. Amazing and really useful. I live by it daily. It makes it easier for staff to check and keep on top of things, and things get followed through and dealt with.
RESTORE2 is free to use and is available from the West Hampshire CCG website or NHS Creative. RESTORE2 has been designed to support carers to recognise and respond to physical deterioration. It was co-produced by West Hampshire CCG and Wessex Patient Safety Collaborative. It is free to use in its entirety and must be acknowledged if used as source material for other tools.